Hi, so my name is Shanelle Ray and welcome back to TGH's newest podcast series called TGH Talent Talks. And we appreciate each of you for tuning in every week, but we are going to have a little bit of fun again today where we learn about our team members, their unique career journeys, and the endless career paths that exist inside healthcare. And as I said, my name is Shanelle Ray and I'm the Director of People and Talent Strategy at Tampa General Hospital. I'm pleased to be joined by two people who have a very interesting story that they are prepared to share with us. So when we have a healthcare system as large as ours, we have over 800 positions and titles at any given time. And so we always hear the stories of, oh, you work at a hospital, you must be a doctor or a nurse. Wrong, at least for me. But we're excited to unpack some of the titles that we have here with us today. And I'm excited to introduce Michael and Veronica. And I would love for the two of you to introduce yourselves and tell us a little bit about both of you. And over the next 30 minutes or so, we will get to know more about your story and hopefully help other people understand what it is the two of you do. So Michael, why don't you tell us a little bit about you?
Yeah, thank you. Thank you for having me on today. Like Shanelle was saying, my name is Michael Escobar. I'm one of the advanced practice providers for TGMG. I've been with the company for almost 7 years now. Really enjoy everything that I've been able to accomplish and the growth that I've had within the company. So an advanced practice provider, an APP, what we do is very similar to what the medical doctors do, the physicians. We are kind of that point person for providing care to patients. So this can be triaging patients, taking their health, their physicals, doing physical exams, ordering tests, diagnostics, interpreting that, and ultimately coming up with a plan of care for these patients. And so the APPs, specifically at TGH, we can have them practicing in primary care clinics. We can have them practicing in specialty clinics, bariatrics, surgery, many different specialties that we have across the TGH. And so we're there just like providers. We are there to provide care to them, diagnose, assess them, and then ultimately try to get them to better health and or solve their particular health complaint, right?
We're excited to have you here with us.
Thank you.
I'm very excited to introduce Veronica and hear a little bit about who you are and what you do.
My name's Veronica and I'm a medical assistant. I've been with TGH 9 years in December. I have gone through the more laid-back transplant medical assistant to now the very chaotic primary care medical assistant. It is a bit of a challenge still with the training and experience that I have. It can be challenging. You don't get the same patient every day. Everything can be different. Transplant, like I said, is very laid back. You're welcoming, you're triaging, you're getting patients ready for that provider as best as you can. You want to ask as many questions as you're able to better prepare that provider to come in and assist that patient without any delays in their treatment or care. Ultimately, I do my best to anticipate the needs of my provider, not just my patient, because at the end, it gives them a better outcome, better turnaround for their day throughout that day and production, and we can maximize our ability to see as many patients as possible. And in doing so, it's very gratifying because I'm not just helping patients, I'm also helping my organization by helping my providers continue great quality care.
If you had to describe what being a medical assistant was like in 2 sentences, what would that be?
I would say your medical assistant is going to be that first person to give you that feedback, opinion, or maybe just be the person to just hear you. Because sometimes our patients just want to be heard. There's not really much we can do, but just listen. I think we're just that first person that interacts with them to help give them that empathy that they are looking for and opportunity to help guide them in the right possible direction and to provide them with that open floor, whether there's feedback or there's no feedback, and the ability to help them move forward with that visit with confidence and the ability to say what's on their mind and also give them the advocacy that they need and making sure that they know that they have a voice in what the decision for their care is.
Perfect. Michael, as an advanced practice provider, somebody in the primary care space, what does having a medical assistant mean for your ability to provide care to your patients?
Oh gosh, that's my right hand man or right hand woman in this case. My backbone. if I can put it into one word. She's, like she mentioned, she's there to kind of get the healthcare process started for that particular patient, the patient experience, right? So she's there greeting the patient, walking the patient back, getting the vital signs, and really kind of laying the groundwork for me to get the information I need to begin starting in my own brain, kind of internalizing and starting this plan before I even walk in to say hello to the patient. So she's doing a lot of let's say the legwork for me in seeing this particular patient. And then, when I come in, I already have a lot of the information at hand, which from a patient experience standpoint just makes that better because we're not, playing catch up or not having to circle back. Things are just flowing. They're natural. And it allows us to kind of have more of a conversation. So I'm very grateful for that because that keeps us on time, keeps us on pace, and allows for that good patient experience. And then ultimately when I'm done, when they're going back in, they're a huge help because they are kind of setting the expectation then for that next visit, whether they're scheduling appointments, kind of recapping everything I just went through with that patient. And for a lot of patients, that can be overwhelming because I'm potentially saying some medical words. I try not to. I try not to give too much medical jargon, but sometimes, we do speak in a kind of a foreign language, right? And so they may be overwhelmed. They may be shy to kind of ask some questions, right? They don't want to be portrayed as, not having the health literacy, right? So they may not feel comfortable off the bat. And then so when my medical assistant goes in, they might feel more comfortable and ask, and she's there, he or she is there to kind of answer some of those questions, right? So they double check us. Yeah, they're kind of that front line and also that back line just to keep us in check and double check us, and we work very nicely in that manner. They are, like I said, they're the backbone of what we do and really assist us in allowing that patient experience to kind of happen.
So what I'm hearing is Veronica's in charge.
Yeah, pretty much. I could not have successful days and great patient care, quality care experience without our medical assistants, hands down.
And Veronica, for you, when you think about somebody who knows nothing about medical assisting and what a medical assistant does in terms of tasks and performing an end-to-end visit, if I'm a patient and I'm coming in and I'm seeing you, and I'm guilty of this. I have done this before. I have seen my medical assistant and I'm like, oh, they're my provider. I'm going to tell them literally everything that they
But I
don't
want you
need
to.
know
I want
about.
you to tell me everything.
Right.
Because then I can dissect that and my provider will have what they need for this visit. And I will give you that expectation that today we may not be able to meet and discuss this because this is priority. Everything that you bring to me is important, absolutely, because it's what you're concerned about. However, we need to itemize what is the most important, and this is what I feel it is. So let's handle those today, and I will ensure that you have a close follow-up with the next available provider, if not your provider, to address those things or those needs that you feel need to be met. And we will meet them, just not today, maybe at a later time. Or sometimes, because not everyone is versed well in the medical field, it's, well, I need my mammogram and I need to talk to them about my colonoscopy and I saw my GI doctor, I don't have my colonoscopy results. A lot of it is just educating them on the correct pathway of obtaining what you need. So yeah, you're here for your physical. I'll get you that order for your mammogram. You don't even have to talk to Mike about it. Oh, your colonoscopy, I see the report here. Do you have a follow-up appointment? At that follow-up appointment with that gastroenterologist, they're going to review that with you. However, if after that visit you're not satisfied with what the plan of care is, then we can schedule another appointment. So a lot of it is just questions that they don't truly understand or know the answers to, or no one educated them about it. So a lot of it is giving them that proper education so that they have a more successful, focused visit with that provider.
Right. And it sounds like, to Michael's earlier point around, it makes them more efficient because by the time the patient gets to them, they are aware of, this is what I'm able to talk to my provider about today, and this is really what we're focusing on. Everything else is super important to the care continuum. But today, in the time that we have, this is what we're going to address. And I think that makes a big difference in the outcomes that we provide to our patients in those times. So we talk about our roles and what we do professionally. But what does it mean for you to have a provider who understands and sees your value?
It's very gratifying to have a provider that sees my value, understands my value and what I bring to help them. But not just that, it goes a long way when it's gratifying at the end of the day to work for a provider that is understanding and empathetic and sympathizing with their patients and doing their best to give them that quality care that they deserve and come to see us for. That is very gratifying. It brings great pleasure to be able to go to work and say, I work for that provider.
Mm-hmm. And I would agree with you on that one. I think you have a good one here. But we'll shift for a second into how you got to the place that you're in right now. So I think there's so many pathways to get to one place. I think I would love to hear a little bit about how the two of you ended up together in this place, besides the obvious of you both got a job and took it and ended up together. But how did you end up together? And that begins, I think, with choosing the career path that you took. So Veronica, why don't we start with you?
I was very young, stubborn. I want to say I'm independent, but the correct word my mother would say is stubborn. And when you're stubborn, you're very independent and what you want, and that's what you're going to get, and that's what you're going to do.
We'll clip that portion and send it to your mother and say, perhaps you were correct.
You were right, Mom. I always knew I wanted to be somewhere in the health field. At my younger age, it was, I'm going to be a nurse or potentially a pediatrician, and it's always been health field for me. But as you get older and you go through things throughout your life, especially as a young woman, becoming a woman from, that transition, you dive into different things in life and discover different opportunities. I did initially want to do nursing, but I did see that the quickest way to get into the medical field for me would be a shorter period of time in school, would be as a medical assistant. Although it may not be at the level of nursing, it still did come with a lot of those skills that are required of you as a nurse, as in being able to identify certain things, assist the provider in a lot of different aspects, draw blood, make sure that things are running smoothly, dissect that patient information, whether you're putting in their information from their previous primary doctor or whether you're looking and researching on what's going on, what events have taken place so that you can better prepare for that provider. So it was just a good start for me to get my foot in the door and then go from there, because once you start in a career field and you're knowledgeable of certain things, later on in life things become easier once you're putting foot forward for that, whichever career it is. So I started off as a medical assistant. I've always liked surgery. Everybody sees Grey's Anatomy. You want to be in the OR. So
only if there's a McDreamy or like a McSteamy there or something.
McSteamy.
Right.
So I went ahead and I did my search techs. I did enjoy it, the time that I spent in the OR in Penn University and in New Jersey and Pennsylvania. However, being a surgical technologist, you don't have that one-on-one that you do with the patient in any clinical setting. They don't even remember who you are. They don't know you were there. Right. So you don't have that relationship. You don't build that rapport, that connection. And that is something that was missing for me. So I did end up going back to that clinical setting because that is what I feel I enjoyed and was very gratifying for me. So I've been with TGH now going on 9 years in December. And I do know that being in the clinic setting for me is ideal. So hopefully moving towards the future, as I am an employee with TGH, they offer so many different opportunities to help guide you and further your career, whether it's your career and pathways or whether it's going back to school for education. So I do look forward to becoming a nurse and assisting those patients even further as best that I can, hopefully in a clinic setting, but if not, we'll see where it gets me.
Mm-hmm. And Michael, how did you end up here in this lovely podcast studio with me today?
Well, Veronica, you made me go through Veronica.
I did. I know it's a hard act to follow.
I know. My parents were immigrants, right? So they came straight from Colombia. So, my dad worked 2 or 3 jobs, to maintain, the bills and stuff. And my mom, because my dad would work, my mom was a homemaker taking care of both me and my brother. So I didn't really kind of have that healthcare experience growing up, right? Like my mom wasn't a doctor, so forth. So kind of when I was doing my prereqs in Hillsborough County, HCC, what I noted for myself is I wanted to work in a field that I can communicate and build relationships. I love communicating with people and socializing. I initially was like, maybe business, maybe something in healthcare, just because I'm interacting. And then as I was kind of furthering my education, taking some of those core classes, human anatomy and physiology, really, I say this, not cliche, but that really changed my life. I fell in love with the human body, as dorky and nerdy as that sound. Just fascinated me. So very tough class, but it fascinated me. And I was like, you know what? I love the body and I'm so nerdy and I want to know kind of all the ins and outs and how this works and how we can continue to improve kind of our bodies and keep our health, right? So I was like, okay, this healthcare field, let's see. So ultimately with that, I wanted to do physical therapist. I was a sports guy and injuries and physical therapy, rehabbing, that all just kind of made sense to me.
I can see that.
So can I literally, as you're saying that, I'm like, as you were talking, I was like kinesiology, sports science.
Yep. So I started taking those prereqs, which are very similar to some of the other healthcare pathways. And then I quickly realized, I was like, man, doctor of physical therapy. Do I really want to be in school for that long? At 19 years old, I was like, I just want to get out there, start working, helping people connect. I really don't want to be in school for 15 years. At least I thought it was that long at that time. So I was like, and then someone kind of got me, hey, you should look at nursing, 2-year, 4-year degree. And I was like, okay. All right. So I looked at the courses and they were kind of similar in terms of the prereqs. So then by the time I completed microbiology and some of the other ones there, I applied to HCC nursing school and I got in and I was like, oh, wow. Okay. So then I was in nursing school and I can never forget this. My first semester was a shock. I didn't realize just how difficult that program was. Right from the first test after I received that grade, I was like, wow, okay. I'm going to really need to buckle in because pretty much up until that point, I was thankfully, I had enough comprehension skills where, okay, I know I need to know this and I'll get like a B+, A- on the test. That's all and I quickly knew that I needed to learn everything to be well-rounded and to be successful. Right. So then I completed my 2-year degree at HCC, became a nurse. And from the get-go, I knew, okay, where is the most team environment? Where do I see myself making the most impact? And so I quickly fell in love with the ER. I had it. One of my rotations was actually in the ER and I loved it. I loved the team atmosphere, working with so many nurses quickly with your physicians, APP colleagues, and just so all the different specialties that are involved in ER in there. And then obviously the fast-paced environment, right? So I loved it. I knew that's where I wanted to work, and I applied for my first RN position at Brandon Hospital, local, and I loved it. I loved the team. I loved what I was doing, the impact care that I was providing, just trying to help my patients from where they were coming from, why they were here in the ER, and then getting them safely and stable. And then about a year or so, kind of getting into it, I quickly found myself, well, why is the doctor making this decision for this patient? I don't know if that's the right kind of plan of care for them. And so that's when I started realizing, I kind of want to be the one empowering the patient and kind of making the decision of what I think is best for the outcome of this patient, the plan, and kind of recovering them. So I started seeing where I can advance my career. I quickly found nurse practitioners were similar to our physician colleagues in terms of we're providers, we assess, we diagnose, we make medical decision making, and I was kind of already in the nursing track. So I went back to school, got my bachelor's in nursing, and then ultimately there I applied for my master's in science at the University of Tampa. And then for their family nurse practitioner program. And when as I was going through that 2.5-year program, I was kind of in between myself deciding, do I want to be an emergency nurse practitioner or a family nurse practitioner? And it was TGH that I had a particular rotation with one of our TGMG clinics. And I was in awe. I really was. I was blown away by the team care, the patient outcomes, and the continuum of the patient. So seeing that patient, taking care of their particular problems for that day, following up, taking care of those problems, and there's just ultimately having that continuity of care and follow up that you typically don't get too much with the ER. I had an opportunity that presented itself at the very same clinic at TGMG Brandon, and I'd be dumb to pass that. So I said, you know what? I think this might be a time for me to I thought I wanted to be an ER way back when, but I think this is the opportunity to kind of open that door and see, the what ifs. And then 7 years later, here I am. Great decision I made. It just made perfect sense. Like I mentioned, that continuum of care, still having that team that I work with, Veronica being one of them. And then having that opportunity to just that constant follow-up with patients is something that I dear more. When I see you as a patient and you bring your family members to establish with me, I mean, that's the ultimate reward for me. So.
Yep.
What is it? We're all friends here. You just pretend he's not here. No, I'm just kidding. But what is the most rewarding part for you for working with a provider who's as passionate as Michael is?
Knowing that the possibility for my family members to have equal great care, it's out there. They don't have to settle for do this and do that, and that's what we're doing. Knowing that there is somebody out there for each patient that's going to give them say in their care and in treatment, to better them in life, and not just, because my background is Hispanic, and my grandparents have always been the type, well, the doctor said, and I have to do this because the doctor said, and maybe I'm going blind in one eye, but I'm going to keep doing it because that's what my doctor says. With providers such as Michael and with our organization, they give those patients the voice that they deserve and advocate for them. Like, we can do this. Mm-hmm. Oh, you didn't like that? We can also do this. These are our options. What do you feel is going to be the best decision for you? And knowing that my family has that access as well is very gratifying. Mm-hmm. And I appreciate it.
Pivoting a little towards your educational pathway, you said that getting a medical assistant, it was your foot in the door into the healthcare system. It was a shorter educational period, but you still got to flex that muscle of patient care that you were looking for. What did school look like for you while you were going through your medical assistant certification?
Being a single mom at the time, it was very difficult. Sometimes, there were times where you're like, I can't do this. I'm done. I'm just going to go work at Walmart or something. But always wanting to be better and always keeping that faith that it's going to be better at the end of the day really paid off. Because I truly enjoy what I do. I enjoy everything that I learned in school to apply to what I do in my everyday. Even becoming a surgical technologist has bettered me as a medical assistant, because I know that cut, they're going to tie, they want the clamp, they're going to cut, so I anticipate the needs of my providers in clinic. Everything that I've learned in other fields, even as a mom, I apply to the job that I do on a daily basis, because it's, patients that they had COVID, they did an at-home test. Okay, when did you test? What are your symptoms? Do you feel anything now? Everything that I learned, even if I struggled, even if I took a break and was like, I give up, I'm not going to do it, it helps you later on in life. Yeah, it can be trying. You do the anatomy, you do the physiology, terminology, I think for me was one of the most difficult, because it's like, wait, that's not how we say it in English, and they're not going to understand. So, even the medical terminology, everything that came with the hardness, the certification test, everything that came with it at the end of the day is beneficiary to what it applies to in a daily basis in your setting, whether it's, I don't know, there's some medical assistants over at TGH that work in the pre-op portion, bariatrics. It's going to go, it goes a long way. Even when you think it's not, I'm never going to, like when you're in elementary, I'm not going to use that in my everyday basis. We do. Mm-hmm. We use it in our everyday life. There's a lot of, I don't want to do it anymore, but it can be very gratifying, especially when you're in that clinic setting and, here's where that applies. I'm glad I didn't give up, and here's where I am today, and it's helped me be a better person and shape who I am, not just in my daily life, but as a patient advocate.
Mm-hmm. And so most medical assistant classes or certifications take about 15 weeks, some a little longer, some a little less, depending on what it is that you do.
Yes.
That seems like a long time in when you're really thinking about it in reality.
And the younger you are, yes.
Yeah, and you're like, 15 weeks, what am I going to do? Like, I could be doing so many other things for that 15-week period.
It is worth it, though. The time you put into it and the focus you put into it, the time goes by faster than you think. So today it's, I got 15 weeks. Tomorrow it is, oh my gosh, it's already Christmas. If you see it in that perspective, it's going to fly by. It's definitely worth dedicating your time and growing that education and molding yourself to learn those things. Before you know it, you're walking the stage and you're receiving that diploma of completion. And it's even more gratifying when you finish your certification, because now you can go on to bigger and better things, and you learn more, and you'll be able to go on to your next chapter, your next career, whether it's a search tech, nursing, pediatrician. You have a start that, you're opening that funnel of knowledge. Mm-hmm. So everything's just falling in there, and you're learning and you're growing, and you can apply it to a lot of different things, a lot of different choices that you make in life, whether it's a nurse, a APRN, a provider, maybe 20 years from now, maybe 10 years from now, maybe who knows. It's all what you put into it and the drive that you have for it. If at the end of the day, it's what you want, regardless if it's 7 months, 3 weeks, you'll get there. Mm-hmm. You'll get there.
So the two of you obviously work a patient workflow together often. What does a perfect day or a perfect day in the clinic look like for the two of you?
Everybody comes in for what they said they're coming for.
Even better.
They're scheduled for what they said they want to see. Because that's my first thing. So I see you're here today for your physical. Is there anything? I shouldn't, but I do, because I don't want my provider to be surprised or caught off guard. Is there anything else that you would like to discuss with your provider today? Any other concerns? As a matter of fact, I saw my best friend the other day, and they're on Ozempic. They've lost like 40 pounds. So now
Skinny.
here, and a lot of things goes into these new weight loss medications that a lot of patients are not aware of, because they're not in this setting. They don't know, they don't have that education. Mm-hmm. Okay, so what is your insurance? Are you covered under your insurance? Oh, yes, they cover it, but did you get specifications? What is the criteria they need you to meet to provide you with that medication? And they're like, oh, I didn't know. Yeah, oh, okay. So most of the times they don't ask the provider, because now they have the education they need. And sometimes they still do ask the provider, right. But in a magical world, they're scheduled for what is on the notes, and that's it.
That's it. Michael, what about for you?
In a perfect world, everyone's on time.
15 minutes early.
Right.
2 hours late, I want to be seen. We'll reschedule. So no, I would say kind of what she was alluding to, just making sure we're going through the day. The clinic days can be very, very busy, seeing a lot of patients, addressing many of their health concerns. And we as providers, we're counting on our backbones, right? Like I mentioned earlier, our medical assistants, as well as our front desk specialists, our office supervisors, just to keep that clinic flow, I think is crucial. And they support us by maintaining that clinical flow, right? So, there's always going to be a little wrench in the wheel that happens, but just knowing how to kind of pivot, be flexible, and then kind of getting back into that flow. You'll have some visits that are faster, some visits that are a little longer, right? And that's just kind of the ebbs and flows of the day, but just staying on flow and taking care of the patients, their concerns, and getting them scheduled for those follow-ups, getting them kind of being that health navigator to get them to where they need to be is the most important thing for a lot of them.
At myself, as I'm running to the clinic, I'm like, my appointment starts in 3 minutes and I'm 6 minutes away. I'll be there. But I think the point of a podcast like this, or the things that we do, is to help people can't aspire to be what they can't see or what they don't understand. So if you have somebody watching this, or you wish that you were watching this when you were 17, 18, 19 years old, making the decisions, for someone who says, well, maybe medical assisting is for me, what is something that you would want those people to know?
Don't give up. You can do it, whether it's, something you're going to do for 45 years and you'll retire, or whether it's something that's your stepping stone where you're going to begin. Because everything you learn in life ultimately helps you in your daily day-to-day, whether you believe it or not. It helps you be more empathetic. It helps you continue to be humble. And just always want the best for other people, regardless of the discernment that they come with. Because not every patient is easy. Not every patient is happy. We want them to be happy when they leave, of course, but not everybody is happy when they come in. And it can be challenging, and learning new things and learning a whole new way of doing things can be scary and hard. It is going to take time, and it is new. Sometimes a lot of us don't like new things. We don't like to do new things and change the way we do things, but sometimes it's necessary. I would say just keep pushing, keep trying. And even if you need a break, take a break, come back, but keep going.
And of all the places that you could be a medical assistant, why do you choose to be one at Tampa General Medical Group?
I've worked for a lot of different organizations. I will be honest and say there is potential to where my earnings could be better. However, that being said, I've stayed with TGH as long as I have because of the way they have shown me their support. They've always been there to help me. When I started with TGH, I was a single mom. I didn't have the great husband that I have today. And I've little by little learned all the amazing things that TGH does to support their employees and help them and guide them. My car's caught fire here at TGH before, and the TGH Employee Emergency Fund helped me through that. And I was a single mom at that time, just relocating back from New Jersey. And it was hard. It was hard, but they were there for me. In my greatest time of need, they've always been there for me. My children are my priority in life, no matter how old they are. And TGH has always supported me in that. I've always had the ability to insure them and make sure that they have the insurance and the health care that they need. I've always had the guidance that I need to better help them. My mental health has never always been great. I don't know, especially in these days after COVID, nobody's is. But they've always been there to help me in the best way that they can and ensure that I still have my employment and my education that I want to further in if that's my choice. There's so many different options and useful things that TGH comes with aside from what they're paying you hourly. They're there for you as a community. They're there to help you. They're there to support you, but also give you an employment. But I will say they are there for their employees in their greatest time of need. All you have to do is just speak up and let them know that right now is not a good time and what can I do? How can you help me? They're always willing to help you.
We're just as lucky to have you.
Thank you.
And Michael, I think for you in a provider position that you're in, whether it's someone who is currently a medical assistant or someone who's seeking a career to be in, they may be an MA right now and they may want to be a nurse or they may want to go back to school, or they may say, well, the provider that I work with right now doesn't value me, so maybe I should go back to school and maybe I should further my education so I can get some respect. You are a provider very clearly today that we see that your team value you and the way in which you work with them. What advice would you give to anyone, MA, non-MA, RN, APP, aspiring? What advice would you give them about the position that they're in right now and how do they map those next steps for themselves?
Yeah. I think just trying to establish, having kind of that internal conversation with themselves. Are they a passionate person? Do they love connecting with people? Do they love helping people? Then, if those kind of check off, I would say they're in the right field. And if so, if they want to kind of hire their education, then that's the perfect opportunity. One of the other things that I would highly recommend for someone who's maybe, as a medical assistant, as an early nurse or, nursing assistant is to have kind of that mentor, right? Mm-hmm. That's been huge for me, having that mentorship. And that's what TGH is all about. Not to follow up Veronica's response, because that was powerful. That's way too hard to follow up. But TGH's family culture is second to none, right? Their opportunity, their support, second to none. Kind of having that mentor that you can look up to kind of help guide you, if furthering your advancement in your career professionally, personally, is something you want to do, then it just makes sense. But it kind of, is this something that you really want? And if so, does that make sense for you to advance? And then kind of getting some of that information and that input and that constructive feedback to kind of getting you there, right? Mm-hmm. So
perfect. Well, we are going to end our segment with a fun game that we like to play, and it's probably going to be fun for you and not so much for him. But this game is called Blind Ranking. So it's a game where we rank the current item without knowing what the next item is. Uh-huh. So we are going to rank things 1 through 5, but you don't know what's coming next. So with that being said, as a medical assistant, 1 through 5, most irritating to least irritating without knowing what's coming next. Right. So the first one on the item is your provider adds another 2 patients to the schedule. 1 being the most annoying, 5 being the least annoying.
You can only use that number once, right?
Correct.
Okay.
I'm going to give it, I don't mind because sometimes it's necessary. I'm going to give it a 3.
Okay. I like that. I like your approach. Your provider is currently 30 minutes behind schedule and decides that now is the perfect time to take a lunch break.
I don't think my providers would do that. But I would say a 4. That must have been a very exhausting conversation.
We are at the end of the day.
But necessary.
Oh, but necessary. You're at the end of your day. Every patient has been seen. Your provider has left. You're looking at the schedule for tomorrow, and you see that he is having an administrative day and forgot to tell you before he left. And you now have to reschedule all of his patients.
Number 5.
That's a number 5. Even better. Even better. You have a patient that you've just triaged, that you've gotten them ready, you have everything prepared for. Your provider comes in, and the patient has changed his mind. It's a completely
that's
new
a number
appointment.
1.
Number
That's a
one. No, number 1, we can all go home now. We can all go home.
That's number 1.
No, which leaves the number 2 spot for, no, it's not that bad, that you have come in, your schedule is full, you're ready to go. All of your patients have forgotten every single medication that they were on. So you have to spend an additional 30 minutes going over their medication management. It's at a number 2.
I'll take that at a number 2. That's
Even
fine.
better.
Because it's going to, me going over it, it's worth it for their next visit. We've got everything in line.
Whether or not they can remember if they still take Eliquis or not.
I'm mailing you a list, honey.
Right.
We're mailing it.
We're mailing it. Well, I appreciate both of you taking the time to spend some time with us and educate us a little bit about what you both do and inspire the next generation of people who are entering the workforce.
Thank you for
to
having
really
us.
consider it. And is there anything that we haven't covered or anything you would like to say?
Thank you for dealing with my
Your beauty and your grace.
my hard days, my hard times, my difficult times that aren't few.
And when your
I'm
podcast
here to
career,
support you.
right? When your podcast career takes off after this, we'll remember it happened right here.
These are the roots.
These were the roots.
I'm very grateful to work for the team that I work for, and it's very gratifying. At the end of the day, our patients leave satisfied. Very few are not happy, but we can't always say yes to everything.
Michael, for you?
I would say, for first and foremost, thank you for having us both. It's been our pleasure sharing
Yes.
our kind of stories, and for all the personnel out there who hopefully this inspires, and if they're kind of on the fence about do I pursue a career, do I elevate my career, just go for it. Go for it. Connect with people, get that information, and just go after it. Yeah.
Perfect. Well, thank you both so much for your time. And thank you for everybody for tuning in to another episode of our TGH Talent Talks. And we look forward to seeing you again next time.
Thank you.
you.